certified OBGYN.
And I'm Rachel, a board-certified pediatrician, and I'm also Renda's first and best daughter.
Well,
Today's Father's Day.
yeah,
It's Father's
happy
Day.
Father's Day. And today is
Yay!
John's first Father's Day. Yeah.
Yeah, it
So
is
how did
his
that
first
go?
Father's Day. It went really well. All week I was like, "What do you want to do? What do you want to do this weekend? Let's go do something fun." And he was like, "I just kind of want to be at home." Because last weekend his sister came in town and we showed her everything and we were constantly going places. And so he was like, "This weekend I just kind of want to do nothing." So it's been
That's
really,
kind of nice.
yeah,
Yeah,
it's
that's
nice.
kind of nice.
He's been in his
So,
own man cave, doing his man stuff. And then we did go out for like a brunch, like a brunch buffet that he really likes brunch buffets. So,
oh,
and
that's
right now
nice.
he's
Yeah.
watching Judah.
Oh, perfect.
Happy Father's Day.
Babysitting. Happy
Yeah.
Father's Day. Yeah. Well, we had a barbecue, and my husband, Edson, he had to do his own barbecue. He had to cook his own meal. But it's nice. We
He's
had
a
a great
great cook,
Father's Day.
though.
Yeah.
He's a really good cook.
And today is a beautiful day. I know it's really hot where you are. Where we are,
Yeah.
it's like 69 degrees, sunny, sunny, sunny. It is so comfortable to be outside. Just beautiful day. So
Good.
we've
Yeah,
been
you need
blessed
to
with
get outside.
a
Yeah.
beautiful sunshiny day. Yeah.
Yeah, it's like
Well,
in the 90s here. Too hot.
oh, yeah, that's a little too much. I don't know that I could handle that. Well,
Yeah.
I do want to tell you that I am really super excited about today's episode because today we are going to talk about a topic that I think is very important. The birth of a baby can start a variety of powerful emotions, from excitement to joy to fear to anxiety, but it can also result in something that you might not expect: depression, right?
Yes. Yeah. So I know most new moms experience postpartum like baby blues after childbirth. This is a normal thing that happens. And, that could mean they have mood swings, crying spells, anxiety, difficulty sleeping, anxiety. I'll say that again, anxiety. Baby blues. I know that it usually starts within the first 2 to 3 days after you have a baby, and it can last for up to 2 weeks.
Right.
So
But some new moms experience a more severe, long-lasting form of depression that we call postpartum depression. Sometimes it's called peripartum depression because it can actually start during pregnancy and it can continue well after childbirth. Rarely, an extreme mood disorder called postpartum psychosis can also develop after childbirth. So I want to talk about all those things today.
yeah, I tell my patients this all the time because I always check in on my new moms that postpartum depression is not something you are doing wrong. It's not a character flaw or a weakness for you at all.
Right.
It's
Right.
just simply, something that your brain does. It's brain chemistry. It does that. It's simply a complication of giving birth. If you have postpartum depression and you get really fast treatment, to help manage your symptoms, it can help you in all ways and help you bond with your baby, all the things. So,
Right.
it's not something that you should think of as there's something wrong with me. It's not that at all.
Right. And the symptoms of depression after childbirth, they can vary and they can range from mild to severe. Like it can just be baby blues where you just don't feel really that happy. And the symptoms of baby blues usually only last a few days to maybe a few weeks after the baby is born. And they can include some mood swings, a little bit of anxiety, some sadness, maybe irritability, feeling overwhelmed, sometimes just crying for no good reason, feeling like you can't concentrate. Some moms will have appetite problems and some will have trouble sleeping, right?
Yeah. And it's really important to give yourself space and take care of yourself during this time as a mom, because our mental health greatly impacts our babies. It affects bonding and our ability to be fully present with our babies.
Right. So if you're a new mom and you're experiencing the baby blues, you need to ask for help. The
Yes.
first thing I tell people is surround yourself with people who can help you. So, your partner, your parents, friends, reach out to your support group if you have one. Other things you can do, just don't isolate. Get
Yeah.
outside. Sunshine, the sunshiny day we have today can be great for mental health.
Yeah.
So get outside, get sunshine, and make sure you continue to take your prenatal vitamins and iron if recommended by your doctor or midwife. Vitamin D can be especially important, especially in climates without a lot of sunshine, like here in Alaska. But anywhere, low vitamin D can exacerbate all kinds of mood symptoms.
Yeah.
So, including depression and anxiety. Exercise, just going for a short walk can be helpful. Yoga or stretching exercises. And then also do something that you enjoy, like read a book, watch a comedy on TV, play a game, something that's fun, right?
Yeah, those are all such good recommendations. And I know when right after I had JJ, I had one of those wraps that you could wrap him kind of against your body, like a carrier type thing.
Right.
And I would take him for walks down the street and back. We have like some open space with some green area, and it's always sunny here. So just doing those little walks was super, super helpful. And then another thing, getting a shower. I know you don't like think that that's a big deal, but being able to have that, even if it's 10 minutes to take a shower, makes you just feel so much better. Even if you don't put on makeup, you just showering makes everything better. So
Absolutely. I
take time to
agree.
get a shower. But it's really hard because you're not sleeping well and your entire life is revolving around keeping this little new person alive and healthy and meeting their needs. But you need to make sure your needs are getting met too. It's also hard too because you want to do all those things for that baby. Usually,
Oh, yeah. Yeah.
you want to, take care of it. You want to hold it all the time. That's not
Right.
a bad
Right.
thing.
But as a mom, you have to take care of you so that you can take
Mhm.
care of your baby.
Exactly.
Absolutely.
So put the baby down
Yeah.
and go take a shower. It's fine.
Good advice.
So when do the baby blues become postpartum depression?
Yeah, good question. So, postpartum depression can be mistaken for baby blues at first, but the symptoms are just a little more intense and they last longer. They may eventually interfere with a mom's ability to care for her baby and to handle other daily tasks. Symptoms usually develop within the first few weeks after giving birth, but they can start earlier, sometimes even during pregnancy, and they can start later, up to a year after birth. So, postpartum depression symptoms can include a really depressed mood, severe mood swings, crying too much. They can include difficulty bonding with your baby, withdrawing from family and friends, really a loss of appetite, or in some people, it's actually eating a lot more than usual. An inability to sleep, insomnia. And then in some patients, it's sleeping too much. And just this overwhelming feeling of being exhausted or tired, a loss of energy. And every mom has a little bit of that, but just overwhelming sense of you can't even get up and move. Loss of interest and pleasure in activities that you used to enjoy. For some moms, there's an intense irritability and anger, fear, irrational fear that you're just not a good mother. Some women experience hopelessness or feelings of worthlessness, shame, guilt, or inadequacy. A reduced ability to think clearly, to concentrate, and to make decisions, restlessness. Some women have severe anxiety and even panic attacks. But if you ever have thoughts of harming yourself or your baby, or recurring thoughts of death or suicide, you really need to reach out and ask for help immediately. Tell your partner, tell someone, and ask for help. If postpartum depression isn't treated, it can last for months and months and months and even years. Hmm. Yeah.
Yeah. So, and I tell my patients this all the time too. If you are feeling any of these symptoms, um, then after you have a baby, you really might not want to tell anybody. You might be
Yeah.
embarrassed. You might feel like I feel like this is a lot of moms, you might feel like you can deal with it on your own and you can handle it. You can get it under control on your own. But really, if you experience any of these symptoms, postpartum baby blues or depression, please call someone, call your OBGYN, call your midwife, schedule an appointment. And I tell my patients' parents this all the time. If you aren't getting what you need, let me know. Let your pediatrician know too. Like, they might not be able to prescribe you something or help you because you're probably over 18, maybe. um, but they can get you the help you need. So just ask anyone for help.
Right, right. Now, I also want to talk a little bit about postpartum psychosis. So, this thankfully is a very rare condition, but it's also a really serious condition. It usually develops within the first week after delivery, and the symptoms are really severe and they can actually be pretty scary. These symptoms can include feeling confused and lost, having obsessive thoughts about your baby, hallucinations, and even having delusions, sleep problems like really just not sleeping at all, feeling paranoid. And oftentimes, these patients will make attempts to harm themselves or their baby. Postpartum psychosis can lead to life threatening thoughts or behaviors, and it requires immediate attention.
Yeah, if you have symptoms that suggest you may have postpartum psychosis, get help immediately.
Right. And it's important to call your provider as soon as possible if the symptoms of depression have any of these features. If they don't fade after 2 weeks, if they are getting progressively worse, if they make it hard for you to take care of your baby, if the symptoms are making it hard to complete everyday tasks, or if you have thoughts of harming yourself or harming your baby, you need to ask for help right
Definitely.
away.
Yeah.
Yeah.
If you have suicidal thoughts, if at any point you have thoughts of harming yourself or your baby, immediately seek help from your partner, your loved ones, so that they can help take care of the baby. But then you need to call 911 or your local emergency assistance number to get help. You can even just drive to the ER and they will take you and help you there. But also consider these options. If you're having suicidal thoughts, seek help from a healthcare provider. So you can try and call your OBGYN. Or if you have a family practice doctor, somebody, call a mental health provider if you have one. There's a suicide hotline. In the United States, you can call or text 988 to reach the Suicide and Crisis Lifeline. I know that's available 24 hours a day, 7 days a week, and they're free and confidential, and they will talk to you. Reach out to a close friend or a loved one. You can talk to a minister, a spiritual leader, or someone else in your faith community. Just whatever you do, get help from someone.
That's really great advice, Rachel.
Mm-hmm.
People with depression may not recognize or admit that they're depressed. They may not even be aware of the signs and symptoms of depression. So, if you suspect that a friend or a loved one has postpartum depression, or a friend or loved one is developing postpartum psychosis, help them seek medical attention immediately. Don't wait and hope for improvement.
Yeah, for sure. I know that the treatment and recovery time for this can vary depending on how severe your depression is and what your individual needs are. But it's important to see your doctor because they can do testing for other conditions that can affect mood, like thyroid disorders or other
Right,
things.
right.
Yeah. So, if you have an underactive thyroid or an underlying illness, your healthcare provider can treat those conditions or refer you to a specialist who can do that for you. Your healthcare provider can also refer you to a mental health professional. So, you may have one of these underlying disorders, you may not, but either way, you need to get help.
Right. And now we know that the baby blues, those will usually fade away on their own within just a couple of weeks after delivery. So if your symptoms are lasting longer than that, you really should get help, right?
Yeah. So in the first 1 to 2 weeks, in that meantime, get as much rest as you can, accept help from family and friends. They're gonna all want to help so much, and
Mhm.
take their help. I tell that to my patients all the time. Dad is there, or the other
Right.
partner is there. Let him help you. Let them help you. We're so, as moms, we just want to do it all. We want to hold them the whole time. We want to feed them every time. But you have a extra person who is built in to help you. Let them help you.
Right.
um, you can also connect with other new moms. If you are a single mom, there are so many different groups in the community that, are other moms that can help you with things. But bottom line, create time to take care of yourself. We talked about that. It's so important. But also avoid alcohol and recreational drugs, because that really
Yeah.
could make mood swings way worse.
Yeah, that doesn't really help anything at all, right?
No.
I find that a lot of my patients, a lot of moms get really stressed out about breastfeeding, and that can even add to their baby blues symptoms. So, I mean, ask your healthcare provider about getting help, a lactation consultant, if you're having problems producing breast milk or breastfeeding. I've
I want
also
to say
found
something about this. Hold on.
yes, yeah,
Breastfeeding is so hard. No one tells you this
it
before you
is.
have
It's
a baby,
hard.
but it is
It's hard.
so, so hard. And if
Yeah.
you are trying and doing your best, you are doing great. You're
Yes,
doing awesome.
absolutely.
You're doing wonderful. And it
Absolutely.
adds a whole lot of stress, but you can do it. And if you are so stressed out
Absolutely.
that you cannot take care of yourself or your baby, that is why we have formula.
Right.
Please use it. It's okay. You have to be
Yeah.
able to take care of yourself and your baby first. So if you're so stressed about breastfeeding that you can't do those things, just rely on the formula. It's going to be okay. I promise.
Yeah.
Okay,
Absolutely.
that's all.
Good advice. Good advice. So, I've also found that progesterone supplementation can be really helpful, especially for women who have a history of a luteal phase defect or women who have had lower progesterone levels in the past. There's some thought that a drop in progesterone levels that occurs right after delivery may be one of the triggers for developing postpartum depression. So, if you're someone who's at really high risk for postpartum depression, you might want to talk with your doctor, your midwife about if progesterone supplementation might be right for you. Another thing, vitamin D deficiency, that contributes so much to depression. So take your vitamin D supplements. Yeah.
You said some women are at higher risk for developing postpartum depression. How would you know that? Talk more about that.
Sure, sure. So, women that have a history of depression or anxiety before they get pregnant, or women who've had postpartum depression in a prior pregnancy with a past delivery, of course, those women are going to be at higher risk. Women who go through a particularly traumatic birth event or with a traumatic incident that occurs around the time of birth, those women may be at higher risk for postpartum depression. Women who have known low vitamin D levels or women who have a known luteal phase defect or lower progesterone levels can be at higher risk. You can also get postpartum depression after a pregnancy loss. So, a miscarriage or an intrauterine fetal death that can actually put you at higher risk for postpartum depression.
Yeah. And it's not just postpartum, right? Like, I know symptoms of depression and anxiety can start during pregnancy or even a year after birth.
Absolutely, absolutely. I usually say postpartum depression because most of my patients know what postpartum
Yeah.
depression is. But actually, there's a new term that I prefer to use, and probably that's what we should be using, PMADS. PMADS stands for perinatal mood and anxiety disorder. So PMADS encompasses a greater period of time. So postpartum depression is postpartum or after birth for another year, but perinatal in PMADS is from the time of conception to a year after. So it encompasses just a greater period of time. And also, Postpartum depression is just that, it's depression, whereas PMADs would be things like OCD, anxiety, PTSD, all sorts of other psychiatric illnesses. So PMADs has a greater time period, and then it also encompasses more symptoms. Um, but we use postpartum depression because most people know that. But maybe we should be using the term PMADs because it really takes into account more time and more symptoms, and more patients would be included in that category, right?
Yeah, that's really important because, it's not just postpartum and it's not just depression. I
Right,
know a lot of people struggle with anxiety symptoms.
right,
And then
right.
you could also have trauma from birth, psychoses, other mood disorders. All those things can really be exacerbated by childbirth. So,
Yeah.
okay, so can we talk now about how we treat postpartum depression?
Oh, yes. Yes. So, postpartum depression is often treated first with psychotherapy. So, that's also called talk therapy or mental health counseling. Sometimes we treat it with medications, and most of the time, both counseling and medications. So, we like to start with psychotherapy, and it may help to talk through your concerns with a psychiatrist, a psychologist, or some other mental health professional. Through therapy, you can find better ways to cope with your feelings, to solve problems, set realistic goals, and respond to situations in a positive way. Sometimes family or relationship therapy also helps. Examples of therapies used for postpartum depression include cognitive behavioral therapy and interpersonal psychotherapy. Now, we also often will use antidepressant medications. So, your healthcare provider may recommend an antidepressant. And if you're breastfeeding, of course, any medicine that you take can enter your breast milk. However, we know that most antidepressants can be used during breastfeeding with little risk of side effects to your baby. So, work with
Yes.
your provider to weigh the potential risks and benefits of specific antidepressant medications. And if you've used antidepressants in the past, whatever's worked for you in the past may be something that will work well for you again. Now, other medicines. So, when needed, sometimes other medicines can be added to treatment. For example, some women have postpartum depression that includes severe anxiety, right? Or insomnia. So, in those cases, maybe an anti anxiety medicine might be recommended for a short time, or something to help them sleep might be recommended.
Gotcha, gotcha. Yeah, so I know that with appropriate treatment, postpartum depression symptoms usually improve. But in
Right.
some cases, postpartum depression can continue and become long term, and then we call it chronic depression.
Right. And it's important to continue treatment even after you begin to feel better, because if you stop your treatment too early, it can lead to relapse.
Okay. So I heard about this new postpartum depression medication. I don't know how to say it because drug names are weird, but is it Zoranolone?
I think it's Zoo ran alone, so that was really close.
Zoran. Okay.
So I don't know how they come up with the names for these medicines. I think they just have like this random letter generator. But whenever I talk to people in the general population, I just call it Zoo because I think that it's too hard to call it Zoo ran alone. But anyway, yeah. Oh.
So tell us about this medication. How's it different from other medications for depression, and why is it specific for postpartum depression?
Yeah, so this is it's really fantastic. It's the first time where there's been an FDA approved oral medication for postpartum depression. So all the medications that we've talked about so far, like the SSRIs, like Prozac, Zoloft, the antidepressant medicines, those are used a lot for postpartum depression. They're used for depression in general, but they're not specifically FDA approved for postpartum depression. Now, there was another medication that was approved for postpartum depression a few years ago that was called Brexanolone. However, it's an IV infusion. They have to get over 60 hours
Oh
and you
my
have to be in the
gosh.
hospital and it costs like $30,000.
Oh my gosh. So
Yeah,
it's not really feasible for like normal people, just like
right, right.
celebrities and rich people, like Kim
Yeah, really rich
Kardashian
people.
probably took it.
Right, right, probably, but yeah, but we normal people, yeah, it's just not reasonable.
No.
So, um, that wasn't practical. So they were able to take that concept though, and now they've put it in a pill, thankfully. And now that is what is FDA approved. It's not an SSRI. It works really similarly to a benzodiazepine. And as such, it's going to be a controlled substance. It does technically have some potential for addiction. So just like benzodiazepines, and those include things like Xanax and Ativan, they
Oh,
can have an addictive potential. Yeah.
yeah. I didn't realize that it was in this class of medication. So who's it a good candidate for? Should this be like a first line drug for people, or who's this appropriate for?
Okay, so actually, I have not prescribed it yet. The last time I checked, it was not out on the market. But and I think it's coming like any day now. But once it is there, I am going to prescribe it to people who are not having success on the standard regular antidepressant. And you certainly can also take it on top of the regular antidepressant medication, because one of the studies that they did to get it approved was looking at the medication alone versus the medication with another antidepressant medicine. So they've already studied people on antidepressants taking it. And I'm super excited about this medication. And okay, nobody's paying me to say this. I don't like own stock with the company or anything. All right. It's just super promising. But of course, all the studies that we have so far were studies that were conducted by the manufacturers. So I do say you have to keep that in mind, right? I mean, whenever you're looking at a study, you want to see what is the motivation behind the people conducting the
Right.
study.
Right.
And I am super excited about this medicine, but we still do have to wait and see how well it works once it's out there being used in the general population. Now, with that said, there are so many great things about this medication that I love. First of all, patients only have to take it for 2 weeks. 2
That's
weeks.
so great. Yeah. I mean, I know some people get really frustrated about antidepressants because
Right.
it can take 6 to 8 weeks for it to fully get in your system and to work well. And
Right.
then you usually have to take it for a year or two. So that's really
Right.
wonderful.
Right, but zuranolone starts working in 3 days, and you only have to take it for 2 weeks, which is in psychiatric medication, it's just mind-blowing, right?
It is. Yeah.
So that's one reason I'm really excited about this medicine. Now, it works the same way that the benzodiazepines do on the GABA A receptors, but it has an additional mechanism of action that the typical benzo doesn't have. So medicines like Xanax or Ativan won't do the same thing.
Hmm.
But they're in the same category. Yeah.
Oh, nice. Well, I'm excited to see that as it comes out and is more available. I'm really excited to see what it will do. I did not know that people only had to take it for 2 weeks, so that could be really
Yeah.
game changing.
Yeah.
That's awesome. Okay, so are there any myths or things that you wish people really knew about treating psychiatric illnesses in pregnancy or postpartum?
Oh my goodness. Yes. There are lots of myths out there. So I think the first thing, whenever I talk about mental health treatment for pregnant people, pregnant women, the first thing that I start talking about is just how common it is. I mean, we need to decrease the stigma and make people feel more comfortable bringing it up. In some families, it's still taboo. You don't talk about it. And people think that they're the only person who's having this issue. And so I like to start out by saying that 1 in every 5 to 7 women and 1 in every 10 men will have depression. And then patients are like, oh, wow, I feel better. I'm not the only person going through this. Yeah. 1 in
That's
every
good.
5 to 7 women. Yeah.
That's good. I'm
Yeah.
gonna start telling my patients that because I didn't know that.
Right.
But I did know that it is not rare.
Right.
So it's definitely not. I mean, yeah, it's not rare.
Right. Okay. And the second thing, and this is one of the most important and impactful things that I like to emphasize, and I always make sure I bring it up when I'm speaking to a group of pregnant women, is you're not crazy if you're having unwanted thoughts. Okay. Yeah.
No, I tell people this all the time. A lot of moms have unwanted thoughts, like thoughts
Right.
about accidentally forgetting your baby in Walmart, or or accidentally hurting your baby, falling down the
Right.
stairs with your baby, anxiety about not being a good mom. I mean, I even after I had JJ, we went out to eat at an Outback one day, and we were sitting in, a waiting area full of people, and I just started sobbing, and we had to leave and we couldn't even eat there, and I just
Aw.
cried the whole way home, telling John, like, I'm a horrible mom because I took him to Outback.
Aw.
Like, of course, now I know that's insane and crazy, but like, you're not
Right.
crazy. Like, this is something that happens.
Right. And we think that the decrease in progesterone that happens after delivery just triggers an increase in anxiety.
So much anxiety.
Progesterone can be protective for anxiety. And so when it plummets after delivery, poof, you get anxiety. And along with that anxiety, you have unwanted thoughts. And they can be intrusive thoughts a lot of times. And sometimes unwanted thoughts they're typically pretty horrific, right?
Yeah.
I mean, they wouldn't be unwanted if they were thoughts about rainbows and butterflies. So
Right.
the unwanted thoughts by definition would be like something like, what if I drove my car off the road? Or what if I
Yeah.
dropped my baby? Yeah. Right.
Right, exactly. Yeah, I mean, hashtag trigger warning. Like, so when moms start having these thoughts, they worry that they're going to crazy, like
Right.
crazy. And then they're worried that if they tell anyone, they will be looked at differently, or like committed to the hospital or something.
And I have to explain that not only are you not crazy, but this is actually very common. After giving birth, a lot of women go through this, and you're just worried about everything. The
Everything.
differentiating factor between this being something that is versus this being something that's an emergency or that you would need to go get inpatient hospitalization for is the thought, are you okay with it or not? Do you think this is an okay thought or not? So one we say is ego syntonic and one is ego dystonic. So ego syntonic, that is when the thoughts like, I'm just going to drive my car off the road, thought doesn't bother you. And if you're starting to think that maybe it's a good idea to drive your car off the road, and that sounds like an okay thing to do, and you're not bothered by it, okay, that's bad. That is more of a psychosis type picture. And that is an emergency.
Yeah, they wouldn't really be unwanted thoughts if you're starting to want them, right? Then they're wanted thoughts.
Right. And in that case, it's typically other people that report it to me. Like the husband will come in, my wife is starting to think that this is actually a good idea, or my wife thinks that the baby is a demon and she actually believes that this is the case. Yeah.
Yes, so that is an emergency.
Yes, absolutely. And thankfully, that's exceedingly rare. Although, if that is something that you're going through, there are medications for that, but it is a true emergency. Postpartum psychosis requires immediate treatment, usually in the hospital. And treatment usually includes medications, a combination of medicines like antidepressants, antipsychotic medicines, mood stabilizers, and benzodiazepines. And we can use those to control the symptoms and get you feeling back to normal. Now, I will tell you, sometimes in really, really rare cases that are really severe, some people even still will use electroconvulsive therapy or ECT. So if postpartum depression is really severe or if you experience postpartum psychosis, electroconvulsive therapy can sometimes be recommended if symptoms don't respond well to medication. So, ECT is a procedure in which small electrical currents are passed through the brain, intentionally starting a brief seizure. And ECT seems to cause changes in the brain chemistry that can significantly reduce symptoms of psychosis and depression, especially when other treatments have been unsuccessful.
Yeah, and ECT, it sounds super scary. And,
Yeah.
you watch movies and you see people like, getting shocked and they're screaming. That's not what it's like at all.
No,
The way we
no.
do it nowadays, they do it under anesthesia a lot of the time. So you don't
Right.
even feel it. But I worked with some psychiatrists who say it's really, really great treatment, and it's amazing and works wonders. You do have to do it a few times. It's not just one time and it's better. But it's really great.
Right.
But anyways,
Right.
if you have
And you're right.
yeah, so
I have seen, go ahead.
go ahead. No, you go ahead.
No, I have seen so many patients that were like, I could not figure out what to do with them. And they've gotten ECT and they're back to normal, back to their normal selves.
Yeah.
And it's remarkable. Yeah.
Yeah. There's a
Yeah.
new thing too, and I don't know if they use this for postpartum depression yet. I think it's mostly used for trauma, but it could be used for birth trauma, where they, man, I can't remember the name of it, but they kind of use hypnosis and they
Yeah.
do different movements of their eyes back and forth
Eyes.
really quick.
Yes.
Yeah, to get them, and it sounds really crazy, but it's
But it
been
works.
really promising. Yeah. So, but anyways,
Yeah.
so if you have postpartum psychosis, you really need immediate treatment to get better, and there is
Right.
treatment available.
Right. So now, on the other hand, going back to disturbing thoughts, this is a thing that I see all the time, is super common. The ego dystonic thoughts, meaning the thoughts are bothering mom. So mom would really just love to get rid of these thoughts. She does not think that driving off the road is a good idea. In fact, she's terrified of it. Those are ego dystonic thoughts, and that's not an immediate emergency. Okay.
I mean, however, it would be nice if we could control those. Okay.
Right. Yeah.
They're actually quite common, and they could be from anxiety or OCD, and patients can feel safe to talk about it and not fear that you're going to be committed to a hospital usually.
Right.
Yeah.
Right. Your doctor can prescribe treatment for you that can help. So the main thing I want to emphasize here is that there is treatment and there is hope. You can get better. I mean, I really love it when a patient says, I feel that I have returned to my normal self. I'm back to the way I was. I'm my normal self again. I mean, that's great, right?
Yeah, absolutely. I know what you mean. So, what's your favorite piece of advice that you would give to an expectant mother or expectant parents?
It would be to make sure that you have a good support system and don't hesitate to take care of yourself. And if anything can convince you to take care of yourself, it would be to do it for your baby. Because basically, if you're not going to take care of yourself for you, take care of yourself for your baby, because uncontrolled mental illness or issues going on with you really affects your baby, right?
Exactly. I love it. Perfect. Awesome. Okay, so that's all that we have for today. We're out of time. I hope that this was helpful for anyone out there who might be suffering from mood issues after having a baby. Really, if that is you, please reach out to someone, your physician, your midwife, and get the help that you deserve. You deserve to feel better. You deserve to feel like your normal self again.
Yes, I agree. And thanks for listening, everybody. If you enjoy our podcast, please give us a rating and review. That helps other people find our podcast. We really appreciate you.
Yeah, we do. And remember, another episode will release next week. So make sure you subscribe and follow our podcast. See you next time. Bye.
Bye.